Well, welcome to the one of the first interviews in the PVI Congress. I am Diego Ruiz. I am from Madrid. I am a vascular surgeon. I am member of the PVI for 3 years ago, and we are here with Dr. Jorinde Leyden, and he's going to talk about some stuff of the Congress. Please, can you introduce yourself?
Yes, thank you, Diego. My name is Jorinde van Laanen, and I'm from Maastricht, from the Netherlands. I'm a vascular surgeon as well, and one of my main areas of interest is deep venous pathology. And I think nowadays, the last few years, we encounter more and more patients with pelvic venous disorders. I think it's, we used to call it pelvic congestion, but we actually don't speak about pelvic congestion anymore because, that referred basically to ovarian vein incompetence. And now there's actually a much wider pathophysiology behind the whole problem for the patient. So that's one of my main concerns in the hospital in Holland. And I'm also I'm also involved in PVI in the venous part, and we're organizing a session on pelvic venous disorders as well at PVI.
How many years do you treat this pathology? What is the protein time?
Well, I think we've been treating it for a long time, especially ovarian vein coilings. But I think in the last decade, but especially the last few years, there's more and more attention to the pathology, to either venous compression, like renal vein compression, or common iliac vein compression. And as a result, a reflux in like ovarian vein or reflux in the internal iliac veins, or just incompetence of the veins, causing a wide spectrum of complaints in patients. And I think we are recognizing the problem more, and also trying to find evidence, trying to find out more which patients to treat and how to treat them. So, we're definitely not there yet. It's not clear-cut diagnosed. It's not, we don't know for sure which treatment we should choose for which patient, but I think we are discussing a lot and with everybody from all countries together, trying to find more evidence and find which patient to treat, which is very important, I think.
Yes, perfect. What would you can say to the people that are seeing us? What to expect? Because when you come to the Congress, you have a new evidence. You have a PBR trial book that is always updating.
Yes.
We can find in this PBR new book about the pelvic disorder disease.
Yeah, for the pelvic venous disease, it's very quite difficult, because I would love it when there would be real new evidence, like a major RCT. There is one running in the United States about coiling of incompetent veins, which is either a sham procedure or an intervention, to find out whether it's the intervention itself that's causing the benefit in the treated patients. But the results, the trial just started, so it's not there yet. We will discuss the trial, but I think what we will do at PVI is discuss a lot with each other, like how can we avoid sending patients to multiple doctors, multiple hospitals, making their journey effortless. Try to invest more in multidisciplinary treatment teams, or actually diagnostic teams. And for the pathology, we do recognize when there's a compression, treat the compression. Whether there's incompetence, treat incompetence. So I think it will be a lot of discussion and sharing international experience, which will definitely help us further in selecting our own patients for treatment.
Very nice, man. We're taking to go there in the TBI Congress. We're looking forward to go there. And also, what you want, what I would like to that you explain to the people that here what they can expect to go to the PBI Congress, about everything, about the Congress, about the business, about the arterial, about everything of the Congress. Can you invite them about the Congress?
Yes, I think it's one of my favorite congresses, because it's it's very there's a lot of all relevant topics will be discussed, and there's multiple interactive sessions. So there's limited lectures, but there's always room for discussion, always very much interaction with the audience. There's like this agora where you can sit next to each other and are really invited to discuss. There's workshops where you can do hands-on. So I think it's it's interesting to everybody when you're a trainee or just a non-experienced vascular surgeon. There's a lot to learn and a lot to discuss, but also for very experienced people, there's a lot of international discussion, and I think it brings everybody one step further going back to work. So I think it's definitely worthwhile visiting, and it's also next to the scientific value. It's also in a perfect location. So I think everybody we really should join it. Looking forward to it.
Well, thank you very much for the interview. Thank you for your cooperation, and we hope to see you there and meet us.
Hope to meet you there. Thank you very much.